Thanks, everyone. We would like to welcome you to our educational webinar today. We really want to provide you with some insights and ideas on how you can enhance the healthcare outcomes with your organization. In terms of our presenters, we got an illustrious group presenting today. These aren't the actual pictures for our presenters, but we are here in support of all of the heroes out there in healthcare today. So we appreciate everyone focusing on saving our friends and family. So thank you. My name is John Ferner. I'm the founder and CEO of ResultsPositive. I've been helping healthcare organizations transform and deliver healthcare as well as manage healthcare services for many years, and look forward to a great conversation today. We have a few key leaders from ServiceNow and their healthcare practice. So Drew, would you like to introduce yourself real quick?
Sure, this is Drew Kerner. I'm the healthcare CTO here at ServiceNow, and I'll go into a little bit more expanded background when I start presenting. So thanks everyone for joining.
Jeremy, would you like to introduce yourself?
Hi everyone, my name is Jeremy Knudsen. Very nice to be a part of the webinar series that we're going to start hosting here with ResultsPositive, focusing on healthcare technology and the transformation practices at ServiceNow. Jesse?
Hey everyone, Jesse Law. Work with what we call customer workflow here at ServiceNow, and it's exciting to be with all of you.
Well, welcome, and thank you so much for Drew, Jeremy, and Jesse for joining us today in partnering here on these webinar series. So the first thing to focus on, and our core objective here, is to really help organizations drive healthcare outcomes. So we also recognize that you're probably focusing in on these areas today, but we see some really good opportunities when applying technology to drive outcomes here. When we look at it from a patient satisfaction perspective, we see three key interactions. One is the intake of that patient, the other is the providing of the care and responding to requests, and the other is the discharge and the transport of that patient. And so there are various opportunities there to apply technology to really increase that patient satisfaction. We also understand that patient satisfaction will help with your reimbursement rates and provide some profitability for the organization. So we're going to have a chance as we go through the conversation today to talk about how artificial intelligence is helping at the bedside to really help patients get access to repeatable questions, get access to requests in a very quick and efficient manner. Also, we'll have a chance to talk about how mobile and mobile on-demand access can give you the ability to quickly get access to the transport for that patient when they need to leave the hospital, and make that seamless and avoid the wait. So those are some examples of applying technology to drive patient satisfaction outcome. Next, when we look at quality of care, first and foremost, there's to make sure that all of the service providers and care providers have access to all the training, all of the guidelines and policies, so that consistent and repeatable care can be provided to the patients, to the donors as they come and get service. So we'll highlight how you can get access to that information, store it in one central place, and make sure that is repeated and tracked so that you can maintain that quality of care. We'll also talk about how you can apply automation and how you can apply automation to managing those requests from all the different internal associates as well as third-party associates, and delivering that care to patients. Next, on cost of service, definitely that's looking for ways to reduce costs, but also there's opportunities to increase reimbursement based on the different healthcare programs. So in this case here, it's also how do we streamline the intake process? How can that be more automated function? How can that be supported in a more digital fashion? How do we automate the claims and reimbursement process? How do we manage that end-to-end service process? So those are some other examples that we can talk about when we address the different solutions that we'll be talking about today. So overall, we want to also make sure that that patient's able to leave on time and reduce that length of stay. We know that's going to drive the increases in reimbursement. So another great example of applying technology to help with cost of service. And last but not least is the service delivery. So we have patients, we have internal stakeholders and associates. They're all making requests. They all need assistance so that we can make sure that patient recovers and is able to be discharged and maintain a quality of life. So how do we take those work requests in one central place and manage those and get those routed and get those automated so that that request process is seamless? How can we enable patients or internal associates so that they can ask questions and have it responded to immediately via a virtual agent? These are all opportunities. Additionally, how can we streamline the onboarding process for clinicians? If we can streamline that process, they can be more available to provide care and increase patient satisfaction. So here's some overall summaries of areas that we're trying to focus on to help organizations drive healthcare outcomes. Next, we wanted to highlight some key 2020 healthcare trends. So these are probably trends in January. We know there's things that have happened in late in January and February that might have changed your current focus, but you're probably at the beginning of the year identified opportunities to invest in some of these new trends as you're looking to continue to provide healthcare and healthcare outcomes to your patients. We see definitely transforming business models and delivery models. We see a lot of that delivery model changing towards health and wellness versus just the clinical type of care when we already have an illness, as an example. Obviously, there's new delivery models when it comes to telemedicine. Some of those are old models. Now they're being an imperative, as we can see with the current pandemic. Wearables, definitely something that's been around. It's getting more adoption, but they're shifting towards health and wellness versus just tracking traditional measures such as heart rate. So a lot of additional ways that you can use that in your organization to create new service offerings. And we also then see big trends here in artificial intelligence and machine learning. So great opportunity there to really look at predictive analytics. How do we predict based upon wellness activities so that we can increase overall health and wellness of those in our neighborhoods and in our communities? Just think of the current safe driver discounts we see in the insurance industry for health and for auto. How can we apply that to health so that others could get a discount on the health insurance based on the wellness of the patient or the wellness of that individual and avoid having to come in and be an actual patient? And last but not least, because digital has already been adopted by many of the consumers of healthcare, they are now very knowledgeable and they're shifting their focus. They're really yearning for health and wellness. Yes, they want to get better when they are sick and have an illness, but they're looking for ways to increase their overall health and wellness, creating new opportunities, new business models for healthcare organizations. So some of these might be on your current roadmap. Not sure where they are today based on the changes, but that's definitely how we need to look at balancing current trends versus our strategic objectives. And last but not least, we know that there's been some unplanned events here this year. And we really appreciate all the healthcare workers that are assisting those that are in need of care. These initiatives or events have really caused everyone to have to react to these unplanned events. So they've taken their initial strategies and now looking at applying these unplanned events. So now digital transformation has become an imperative. Telemedicine now is increasing just because we can't get access face-to-face as much. When we look at regulatory changes and emergency response, now with the government and public collaboration, there's more of a need to track and report. And so there are some other areas that ServiceNow has provided some solutions for customers to help them address these unplanned events. So what I'd like to do next is turn it over to Drew, the CTO of ServiceNow's healthcare organization.
Yeah, thanks, John. So just to add a little bit to my background, so again, Drew Kerner, the healthcare CTO here at ServiceNow. Previous to this was at a different software company and helped build up their healthcare practice, but probably more importantly was a customer at a hospital system for about 10 years here in Colorado. And the reason I bring that up is because our mission statement at the hospital was world-class patient care, and we actually measure that by being in the top 10% of all of our quality measures, whether it was hospital-induced infections, falls ratios, and we had to be in the top 10% to call ourselves world-class. And the reason I say that is because I say that's still my job today. So a lot of those trends that John mentioned, you may not think of ServiceNow in the context of something like patient experience or any of those other categories. But the reality is, at the end of the day, we actually are building up solutions and use cases around those specifically. And so, what I wanted to talk about a little bit today, and again, these are kind of the categories we're talking about, and from the overall corporate perspective, and Jesse's going to touch on this a little bit, but we are a workflow automation engine. And what that means is, think about where you have an unstructured workflow in your environment, whether it's a paper envelope, interoffice email, whether it's a pager. We still have a lot of pagers in healthcare, still a lot of paper process, or even that month-end process of billing where there's a couple hundred emails between the coding teams and the transcriptionists and IT. And that's all basically, those are all workflows that we can potentially look to optimize as part of this process. And those fall into the categories of customer workflows, employee workflows, and then IT workflows. And what we've done on the healthcare side, if you move to the next slide there, John, is we track that journey of the patient care experience. And as John mentioned, a lot of the initiatives now are to push the care outside of the four walls of the hospital. And I just heard from my old hospital, they were basically performing about 3,500 telehealth visits per day now in the light of COVID, whereas they did 2,000 last year, all of last year. So I think that's going to be a trend. Obviously, we're going to see expand. And the key to that is, I think COVID has really expedited this concept of digital transformation. And many of the hospital systems we see are, again, pivoting very rapidly to move to telemedicine and to telehealth, where we'll, I think, start to see some of those wearable integrations as well. So if you move to that next slide, John. So when I talked about the concept of those customer, employee, and IT workflows, what we've done in the healthcare space is basically put the personas behind those. So those customers, for all of us, are the patients, and those are the most important part of the equation, is that patient care process. And most of our customers on the IT side are those clinicians, right? So what are the best ways that we can optimize the clinician experience to keep them out of entering a note into Epic for 2 of their 8-hour shifts, right? And then obviously the processes from the IT standpoint, and we actually split out security because security is so paramount in the healthcare environment to protect that protected health information, patient health information as well. And I'm going to go through a couple of use cases in each of these categories. So John, if you pivot to the next one, one of the first ones that I like to talk about is a solution that one of our partners built out called Bedside Assist. And the origin of this was at a system in Australia where the architect for the system was in the hospital with his father, who had just had a spinal injury and had a surgery performed. And he just felt like he wasn't getting the care that his father deserved. And so as a result of that, he said there has to be a better way. So if you think of nurse call as being this historically binary operation where patient clicks a button, the nurse has to come in no matter what that request is, 40 to 50 times per shift, he was looking to optimize that entire process. So what he did was leverage the capability of a voice assistant. In this case, it was an Amazon Alexa, where that request comes in through the Alexa, the patient makes the request, and it gets routed to the right person doing the work on the other end appropriately. So, for example, a request for lunch goes to the nutritional services team. A request for a warm blanket can go to a CNA or a lower tiered nurse, all the way up to my pain is increased, which can then go to the RN or even to the doctor at that point. So again, a prioritized workflow that, again, routes that work to the appropriate team and has the benefits, in this case, of benefiting not only the patients because they get their care faster, but also those clinicians, right? So they only have to go in and respond to the requests that are appropriate to them and just create a better patient experience. And the cool thing is this is a great one that expands over in our new COVID world for contact isolation rooms, where those nurses have to gown up and gown down depending on whether they're on a contact isolation or reverse isolation. And now we can leverage some things like voice to leverage some of those lower tier requests so they don't have to potentially go put all their protective equipment on every single time they move into the shift. So again, a really cool use case that again touches on the patient experience as well as that clinical optimization. So John, you pivot to the next one. Thank you. Another one that we've seen is one of our core capabilities around human resources, and a very complex workflow is the onboarding of the clinician. So in this particular case, think of that doctor or provider where it's typically a 6 to 9 month process to get that doctor onboarded, whether it's validating their credentials, validating that we can bill for them versus the different insurance companies, and again, can vary even from facility to facility. So sometimes they're employees, sometimes they're non-employees, sometimes they're faculty staff if you're in that university-based system. So again, a very complex workflow, and we worked with a system, to give you an example, in St. Louis that had at their bare minimum 140 different steps to their workflow of onboarding that doctor. And depending on your practice, you're missing out on, of course, upwards of $1 million of billing per month, and even more if you're thinking ortho or neuro, some of the higher tier practices. So, so what we've done here at ServiceNow is, again, automated that process. And John, if you move to the video and start playing that there, again, this is that concept of creating a better overall experience for that onboarding. So within our onboarding application, again, this is all in our mobile experience where that doctor can log in even before they are onboarded. They can do the steps during the pre-hiring process, which include meeting their care team, the other doctors on the team, the other potential nurses, potentially if they have any pre-hire to-dos, such as signing an NDA, they can click on that document. The document gets displayed right there in that mobile experience, and they can even sign within the mobile phone and then submit that back into the appropriate care team. And again, this is a fast 2-minute demo here. This is potentially, happening over a longer time frame. They sign that document, gets submitted back in, and again, think of that workflow that's happening even on the back end. So that gets submitted to that onboarding team. And basically, again, think of those as those pre-hiring processes, and then any steps that happen afterwards as well too. So this is a scenario where they have their licensing and credentials. They can upload those licenses even by taking a picture, sending that documentation in, or manually entering the NPI information for their license as well. So again, this is a great example of expediting that process and theoretically shaving months off of that onboarding process for those clinicians. And the other piece to this as well too is the demo here you see is a provider onboarding experience. So we're doing the same thing for nurses as well. So think of that nurse being onboarded, a bulk set of nurses being onboarded, and hundreds at a time potentially. There's a lot of travel nurses traveling to New York right now to help with our COVID experience, and again, getting them onboarded has to happen very rapidly. So that nurse can upload his or her nursing license. They can get assigned their preceptor if they need to do their clinicals, and again, basically meet their care team. All that information. This is basically the out-of-the-box functionality within our onboarding application, but a great use inside of the healthcare space. So, John, you can pivot to the next slide here. And then pivoting over to some of the IT workflows, candidly, I think this is where we have a lot of our traction historically at ServiceNow, and specifically a number of the integrations we built into the electronic medical record system. So I'll touch on a couple of these, but there's a list of about 8 or 9 different integrations. I'm only going to touch on a couple here just in our short time, but John, if you move to the next slide, the one that really pops to the top of the list is what we call the EMR help button. And the idea here is this is an embedded method for those clinicians to submit a request within their EMR. So in this screenshot here, we obviously have Epic as the EMR, and what we've done is created the ability for that doctor or nurse to go in and with one simple click submit a request over to the help desk team and pass all of the information through to automate that request and let them get back to taking care of their patients. So again, this is a really cool one where they don't have to take the time to submit that ticket, submit that request. We pull all the information from the Epic client, pass it through, and automatically create that request. And we've actually designed this with a couple customers. The current model is a much smaller version of the service portal that you can see here on the bottom, but the goal we had was for the doc or nurse to never have to leave the EMR client itself, and then for all the communication to stay within that single, within that application as well, so that they don't have to go to another system. So I see a question there for ECW. It is on the roadmap. We are definitely starting with Epic and Cerner as our primary ones, but there's no reason we can't theoretically embed this into other clients as well. Mikhail, we can kind of take that offline. You can contact me to get some more information there, but that's definitely one. I had ECW at my old hospital, so I'm very aware of ECW. So, but again, this is a major satisfier for those clinicians because they can simply click that request and get back to taking care of their patients.
So what we wanted to do next, Drew, is we're going to transition over to Jesse, but any final thoughts here before we transition over to Jesse?
No, I think just one quick thing too is we don't have a slide in here because we were going to try to focus on everyone's, I think, a little inundated with COVID things, but the cool thing is we do have as a company 4 different free applications we've been providing, and what I've seen globally is one of the benefits to the platform is the ability to stand these applications up very rapidly. And just to give you an example, we've been working with a hospital system, actually with specifically with doctors at a massive system in New York City, and we're building an expanded version of what we call our self-reporting application, where they're going to allow their patients to remotely enter their pulse ox levels, their blood pressure, and their temperature, and allow the docs to trend that, and then automatically route or create a request for a televisit within Zoom in this case with that patient, all automatically based on potential changes that patient is submitting. So a really cool use case. We stood up a demo for them in a matter of a couple days, and again, that's one of the kind of benefits to this is as we see this accelerated digital transformation, this is a great example of again, standing up things very rapidly, and I think Jesse's going to touch on a little bit of that as well too. So I'll hand it over to Jesse at that point.
Yeah, thanks, Drew. So we just want to start out, we understand that it's important to balance that daily run of the business versus what we're seeing from industry trends, and I think we're seeing the pendulum has shifted so rapidly in this last couple weeks or months to the adoption of telemedicine. Telemedicine's been around, but now we're seeing it go from a couple visits a day in the hundreds to thousands of telemedicine visits. We're also seeing the request for service improvement, and what this is showing is really just, look, at the beginning of the year, we sit down, we kind of pencil out where we're going to put funds, what we're going to take care of, and it usually falls into 3 buckets of patient care. What is our cost to serve? How do we provide the best service at the most affordable price? And then the digital imperative or the improvement. And a lot of times, how do we go from running the business to getting into something that's innovative? And it sometimes takes the current environment to really push us that way. So as you're kind of sitting there saying, like, this is great, sounds good, where do I start? I want to kind of take a step back. So if we kind of move to the next slide, please. And this is a build slide. So I want to foundationally lay the groundwork for the way that we look at the world. And the world, in our view, is all about service relationships. And we all play the role of requester, and we all play the role of fulfiller. So, we as employees of an organization, that doesn't mean that we're fulfillers, because we have to go to other departments. For instance, I have to go to my HR department to understand what our tuition reimbursement policy is. And so that makes me a requester. However, if someone like yourselves asks, well, what does ServiceNow do? I now become a fulfiller and can talk to you about what it is that we do and how we do that. So we say that requesters ask fulfillers for 4 things. So go ahead and click forward. And those 4 things are, I want help, I want to request something I don't have, I would like to change something I do have, or I want general information. And we can see this whether it's a physician or a patient a volunteer, or an employee, those are what we should apply structured work to. So go ahead and click. When we apply structured work, what ends up happening is we create a workflow. And you've heard workflow multiple times, but in our world, workflow create great experiences. That digital experience that you saw on the mobile application, that is all structured work. What does structured work do? It allows for the requester to see visibility into where they are in the process. It allows them to self-serve. They can interact with the technology in the experience that they want to, and they ultimately have the overall understanding of where they are in the process. Go ahead and click. And because we do this all in a single system of record and a single code base, we can then surface that information to anyone in the organization, whether it's requester or fulfiller, in order for you to see metrics, and you're running the business based on dashboards. So this is 1 + 1 = 2 in our world, requesters connected to fulfillers. And so let's look at what this looks like today in the modern world. So today, what ends up happening is we don't have structure. So the requester sends an email to the fulfiller needs more information, the manager needs to get involved and provide approvals. So we end up sending a lot of one-on-one emails back and forth. We have phone calls, and now we get the volume of work to where we have to track that work in spreadsheets. Those spreadsheets go back and forth. Phone calls get made between executives and managers. Managers don't know what their folks are doing. Executives need to know what the department has performed, and so we create PowerPoints. This becomes very cumbersome. It's not efficient. The requester has no visibility. The fulfiller doesn't understand if they're allowed to complete the request or not. The manager knows that their folks are busy, but couldn't tell you what they're working on at any given time. And the executives don't have visibility into the current process to understand where they can apply process improvement or where they've created bottlenecks in their process. So if we step forward, what it looks like in a structured environment is that we empower the fulfiller on the right to actually define the workflow. And when they do that, they can actually serve that up to the requester, and the requester then knows exactly the mandatory information that they have to provide in order to request that service. Because we've structured the work, the manager gets involved to approve or reject before the work actually gets on the fulfiller's plate. When it's there, they can actually complete the work. The requester has seen where they are in the process the whole time. The manager has dashboards to understand where what their staff is working on and potential for any sort of backlog that they could be encountering. They can schedule overtime and things like that. And the executives can see exactly trends around what is going on and what type of requests are happening and where they have bottlenecks. Once you have structured work in place, we're seeing this a lot with general questions. What are your hours of service? Where can I park? Things like that. Do I qualify for, we're seeing this a lot in healthcare right now. Do I qualify for a COVID test? Well, it's a series of questions. We know what that is. So if you go ahead and click one more time, instead of having to have a human, you can actually build a conversation with a chatbot so that you have the fulfiller in the assist mode, but you capture the initial data up front. So this is ultimately where you can get, and this is huge from an economies of scale. We are seeing interactions with bots in the thousands where they're actually getting through to having to be assisted in the hundreds. So we're seeing as much as a 90% deflection rate when this technology is deployed in the marketplace. And it's being deployed right now for a lot of, do I qualify for a COVID test? If you do, then you're transferred over to a live agent to schedule that test, or you're transferred over to be scheduled for a drive-through test. So we're seeing that a lot in the market. So as we kind of look at what makes up a healthcare provider, some are larger than others. Some have portions of this. Some are the entire wheel. But when you think about it, we're looking at it from a healthcare provider is made up of hospitals, the outpatient clinics, the employer groups that are signing up. We're seeing some of this insurance underwriting from larger healthcare organizations, home healthcare. getting the clinicians mobile to the individual instead of the individual hopping in an ambulance and showing up in the emergency room. How do we get our arms around that in order to drive and provide that best service at the most affordable cost? We'll send the clinician to the patient. Health and education services. This is, we see this a lot with community support, whether it's about to have a baby, lactation consulting. We see this around Le Mans, things like that. Then we have campuses, we have physicians, we have patients. Go ahead and build out. These are all the people that can request. So as we build this out, you'll see that there are some groups that are the same, but in outpatient, you have patients, physicians, family members, and then you have your employees, and those employees have assets. As you go around the wheel, you'll see that it's the exact same type of requester, but they're coming into the healthcare provider in different places. How do we keep that organized and understand what our patients are consuming of ours and identify where they could be leveraging other services like a support group in the event that they're trying to stop smoking, things like that. You can make those recommendations. So this is something that we have a structured approach around. And so if we go ahead and jump to the next slide. One of the things that we're seeing in the marketplace is that this has been tackled by technology that's been around for a long, long time. And we've done it. I think that CRM platforms have done a wonderful job, and they were purpose-built for that engagement layer. Let me make it so that it's very quick for you to get a response. So you can come into any channel that you want, whether it's a portal, a chat, a phone call, and you get to an agent. The challenge is that that's kind of where it stops from a structured standpoint. What ServiceNow with the service management approach is we've taken that CRM front-end engagement layer and we've connected it to what we've been in the marketplace doing for the last 15 years, which is that middle office connected experience, eliminating the phone calls, email, spreadsheets from the agent to the back office. And we've allowed for that case to carry through to other departments, whether it's coming in from the agent and needs to be routed to a billing department for a dispute, or if it needs to be routed to a clinician for someone to travel out to the patient. We go ahead and we do workflow, we have root cause analysis, and we ultimately at the back end, we do process improvement. The other thing that our platform is purpose-built to do is handle any of the devices or assets that you put out in the field. So as your devices, maybe it's a scale and you have someone who's in congestive heart failure, and if they gain a pound overnight, they're probably retaining water, that we can ingest those signals and identify structured work in order to remediate and potentially send a clinician to that individual in order to make sure that they're not retaining water. So we have this ability, and it's all a single system of record. If you go ahead and move forward one more slide, this will be my last talking point, is that we really view it in 4 quadrants. It's your patients, your providers, your staff, examining your process to make sure that you are continually improving and refining in order to drive that cost to serve to the best potential outcome. And your security has got to be on point. And so this is how we approach the overall healthcare market and how we transform healthcare.
Well, Jesse, thank you so much for that, and John for hosting us. And I think to stitch this really all together, a couple of key pieces that Drew has mentioned and Jesse has mentioned, and hopefully some of you are resonating with this, is that on the ServiceNow platform, we're outcome driven. And I wanted to give some context of operational resiliency during and post COVID-19. We're also kind of leaning forward. Jesse and I, we had this conversation last night, actually, not only in preparation for this webinar, but we're leaning into trying to help enhance what's the post current environment. What is that going to look like? But we're also resonant to think about what is actually going on today. I like to think of this as where there's chaos, there's opportunity. and not necessarily from a product-centric perspective, but from an outcome perspective. So I'm sharing with you these slides that I put together with a chief information officer at a very large Department of Public Health organization. And I thought that this would be resonant to share, is that look at where I'm going to go here from an outcome-based approach and the how. And I like to think of the how and what are we doing. The end-to-end IT landscape right now is ever changing in the current environment that healthcare is dealing with. But if we even think pre-COVID, there's the reaction to digitally transform. And so having an understanding in these baseline top-down approaches, what are the initial outcomes that need to be focused on? So having a good understanding of what the is condition is now, transparency of that to communicate the value and the speed, as the example of telemedicine being deployed out rapidly using artificial intelligence, oftentimes is on a roadmap for someone to try to get there. But piecing this together and communicating the value and speed of which change can happen is really the digital transformation that we're seeing inside of the healthcare space. Now, these words aren't necessarily mine. These words are in conjunction with other executives that I was working with to actually help them understand how do they focus on the outcomes that were initially on a roadmap to decrease cost, improve the service delivery, the EMR requests, the EHR outages. How do they resiliently solve for those now? And then also mature and speed at a next pace. So go ahead, John, if you don't mind. And I want to break this down to, for those of you who are or maybe not familiar with some of the product names, and you're going to see those at the top, and none of them are in any particular order from left to right, to say business management or operational management or asset management, and our friends in security and risk who are also on the line with us here today, they're all really driven to an outcome-centric approach. And if you go top to bottom, the very first thing we hear right now in the current environment and even previous was, I just don't know what I've got. And so if you think about the business management aspect to supporting telemedicine that Jesse was mentioning earlier, I need to understand my applications that are going to be delivered. I need to understand the bodies of work and the resource and the capacity of how I'm dealing with those components from the people who are actually executing that work. The operational management side is having a visibility across the current IT asset landscape, but also even I'm looking at the asset management side here in the middle column, known as SAM. We have DocuSign, we've seen Zoom, we've seen telemedicine, we've seen a lot of these applications that are now being consumed by organizations to speed up the digital transformation journey, where licensing posture and risk post-COVID-19 is also going to be something that will need to be remediated. But then the risk of all of these components going out, the risk to patient care, the risk to private information, needs to be the foundation of first visibility and inventory, alignment and health of the services that are being delivered, and then the future growth and the velocity to be able to deliver at speed and to deliver at scale. Now, again, these were some of the maturity points from a top to bottom perspective that you could look at and say, you know what, from a growth velocity perspective, we have a really good handle on our asset practice, but we're really, really needing to mature in our business management and our operational or our project and portfolio. Where is the funding from a CARES Act going to be coming in? How are we going to resource allocate some of those funds and track the progress of those? So think of each of these boxes as different levels of maturity to help you align to that. And to really put that into a resonant picture, John, if you don't mind going to the next step, we think of those all on digital transformation, but the industry itself, outside of just healthcare, is moving from a project-centric focus, your traditional Gantt chart, to a product-centric focus. So as this is a build slide, John, go ahead and hit up the next piece. If we think about those components that I mentioned earlier that stitch everything together, what am I working on? What am I building? What am I planning to do? What resources and capacity do I have against my operational state today and the service that I'm trying to deliver? Well, those are assets. Those are risks that are actually being leveraged today in the current environment. So John, next one here. So that product-centric approach that I had shared earlier on the how and how we stitch this all together really ties back to the outcomes. So that if you look on the left side of this ecosystem here, John, next click there, it's that owner workspace. So Jesse really mentioned stitching all of those components together. You saw the requester and the fulfiller looking to execute seamlessly on those actions, where this now starts to transform into a common service delivery model. So everything that Drew and Jesse have been speaking about is really built on a common service data model. So how do we deliver end to end? How do we stitch this all together? So John, go ahead, and next piece is around the configuration management as well. And I gathered these components here from the Chief Information Officer as an example, is that what we're hearing is that the guiding of IT to support all of those based outcomes helps support the growth and the change, driving the innovation, the rapid speed of the EMR help button, the dress up, the dress down, leveraging technology at speed and scale to optimize as well and increase the quality of care and services, being able to deliver at speed and scale. But we're also faced today, in the next slide here, John, with the current challenges. So if we look at that, going to the visibility, alignment, and then growth or velocity, is I can't really tell today, especially in this world that we're dealing with now, what did we have? What is connected to what? Also, the unreliable service availability, the inability to know if something goes down, is it too late to react, or is it frustrating for not only the clinician providing the service, or is it also frustrating for the patient and the care? So helping with the challenges that happen with slow issue resolution, accelerating that speed of resolution is really the opportunity that we're facing today. And so John, if you go to kind of what if healthcare was able to quickly pinpoint the EHR disruptions, identifying the services via automatic discovery and resolution to be alerted proactively and prioritize and remediate and automate some of those service delivery issues to support the how, again, of what Jesse and Drew were showcasing in those use cases, really blends to the technology on the ServiceNow platform that is helping support healthcare outcomes. But it also would be fraught, John, if you go to the next slide, that the disruptive nature, unplanned change and change itself is going to be continuous. We're seeing that today. So disruptive innovation has really helped erode the business models, and it's changing the market conditions so much faster. I like to equate this to Uber as well. So if we look at Uber, when we jump into a car, when we were children, we were told don't get into a car with a stranger, and now that has eroded the business models of taxi cab companies. Healthcare can also change that and erode those because of the digital invaders. Healthcare is at the forefront right now of being able to change continuously, be effective, to ensure not only the operational resiliency of what is being done today, but also really post the world that we're living in for the current environment. I hope that was helpful for everyone. And John, I think we want to give some time here for some questions, answers, and create a roundtable. And any thoughts and feedback if what we discussed today was helpful as part of our webinar series. And thank you for the audience here, John, and the folks that have joined.
Yeah, thanks so much, Drew and Jesse and Jeremy. Great insights there on how we can use technology to really drive business outcomes. And so what we've established now is an open forum. One question we typically see a lot is, so where do I start? I definitely want to get access to some of these solutions. I want to be able to achieve some of these outcomes. So that's something we're going to highlight here in a minute on kind of next steps and how you can start. So that's one of the common questions. Drew, what are one of the common questions you receive from customers?
Oh, there's a lot. I think one that I would say is where do you get started and what are the next steps? And again, I don't want to take up a ton of time here, but one of the things we do pretty regularly is create with this concept of a strategy map to align some of the business issues that you have as a system with what we do and can do as a platform. So to give an example, if you have, again, a patient health or population health initiative, if you have a clinician satisfaction initiative, then there are definitely things that we should kind of map out and see where some of these things that we talked about fit in. And then the other thing is, again, we talked about, Jesse did a great job of kind of framing up the concept of fulfiller and and requester, and I think, basically mapping out how you leverage that in a structured way to build out the appropriate team, the appropriate staffing model, the appropriate governance process to facilitate some of that. Because the reality is, and again, we're not going to do be all and end all of things, but this concept of the platform of platforms we can enhance a lot of those current processes or even make a lot of those existing pieces better. And one other thing too, just to make sure that I double click on that is if you do want to follow up on the question of the ECW, then you definitely reach out to me directly. And again, it's on the roadmap, but we are focusing on Epic and Cerner, just so you're aware, Mikkel. So looks like one more question. You provide the ROI that supports investment in the platform. Absolutely. So one of the things that we do during that process of creating that not even just the strategy map, but any of those pieces we talked about are to map what we call the value associated with it. So we do what's called a business value assessment, where we show the ongoing return of investment in the process too, and that time to value is a critical metric that we use to say, and especially in the time of our tight funding now with COVID and basically hospitals being very careful about where to invest. We're still seeing a lot of momentum with what we do with the platform, because at the end of the day we do have that value associated with it as well. So great question.
Yeah, thanks so much, Drew. I'll turn it over to Jesse. Jesse, any common questions you receive from customers that you'd like to share?
I before the current situation, we were working with organizations around just making sure how do we ensure the cost to serve is in the right category. The other thing is just talking through the competitive nature that is popping up with certain large big box brands now offering flu shots, taking that revenue away from the hospital system and getting the reimbursement dollars. Those types of things are things that we haven't seen in healthcare before, but it's definitely how do I get the least expensive resource to provide the best value support to the patient. That was a big theme. Obviously, in the last few weeks, it's been all about how do I get some form of technology to allow the humans to actually be able to do their job and not just sit on the phone answering the same questions over and over. Just one quick story is, we worked with a hospital organization. They knew exactly what they wanted the conversation to be from a virtual agent standpoint, and it took them 6 hours to basically write the conversation, and then they were concept to production on their website within a week. So it's about rapid response as well. So
I wouldn't necessarily say common questions. I get observations, quite honestly, right now, John, from a lot of the folks that are looking to repurpose or leverage some of the components of things like just demand or the request to do something, trying to get the capacity of, can people actually execute? What are they working on? Do we have the systems to support telemedicine? What do we actually have? So some of those long-standing projects that folks are seeing, they're leveraging parts of their current environment to repurpose and reshift their priorities quickly. And the 4 applications that Drew had mentioned earlier, we're seeing that now those are also being repurposed for volunteer help or donations for things from the community that are coming into city, state, local, and even departments of public health and healthcare organizations. Lots of different valuable tools of the platform. And I think the observation I'm making here is that folks just sometimes said, I didn't know you could do that. And how it all stitches together has been something really interesting, and why I think we're probably keeping some very busy Zoom schedules these days. But thanks for hosting this, John, and giving us the audience to be on here with you.
2 common questions that we receive. One is, how can I really manage my application rationalization? And how can I do that on the platform? And so we receive that common question, especially in today's environment. Everyone's trying to make sure that they're spending their money very wisely in the right areas. And so a great capability on the platform for application portfolio management, being able to really look at your business capabilities, determine what your strategies are there, and then be able to align the overall investment on those applications, but also be able to track and understand which applications are coming up for renewal, end of life, and being able to do that and build additional value on the platform. Kind of one of the other common questions that we receive is, how can I use the ServiceNow platform to help me with my investment planning, my investment funding capabilities, and be able to protect those projects. And so that's a great opportunity to use the project portfolio management capabilities. Many organizations have some of those capabilities part of the ITSA Unlimited SKU, and they haven't tapped into that. So it's a great opportunity to get additional value off the platform with capabilities you already have access to. So those are a couple of common questions that we received. In terms of the timing left, we have about 5 minutes left. And I'd really like to thank Drew, Jesse, and Jeremy for their leadership and for their inputs today. So hopefully everyone has been able to get some nice insights. As we mentioned, and Drew mentioned as well, a lot of times customers ask, where do I start? And our typical question and coming back to is, let's identify what are the outcomes that we're looking to accomplish. So there might be various areas you're performing very well, and so you don't need to focus there. But then there are other areas that you aren't performing well at all. We need to really address those outcomes. That will then drive what are the right solutions, what are the right processes and workflows to increase and improve those outcomes. Or what are we doing really well we want to improve and enhance? And so those can be other outcomes. Or maybe there's new outcomes, right? There's new outcomes. How do we do emergency response better? That might be a different type of outcome we're looking for. And so by identifying those outcomes is really the starting point. Then from there, we typically come in and do a discovery session with the customer. That's where we can help really assess your situation, create one of those strategy maps that Drew was mentioning, creating a specific outcome-based roadmap. That's really what we're trying to focus on, is giving healthcare organizations an outcome-based roadmap. Based upon these 2 or 3 outcomes, what would be the set of initiatives, what would be the various outcomes and results and metrics that you would achieve by those initiatives. As a part of that process, we typically collaborate then with the business value assessment that was mentioned as well. So we kind of see multiple starting points. Some organizations want to do this more strategic planning, but in today's environment, right, we need to quickly build something so that we can support the clinicians in this emergency in New York, as Drew was mentioning earlier. We can come right in, assess that, and come in and start building those solutions. So that's another way to start. So multiple starting points with customers. In terms of what's next out of our webinar series today, feel free to reach out to any of us to schedule your discovery workshop. We can start discussing your strategy map. We can also give you access to some of the healthcare solutions that are currently available. Drew mentioned those, some of the emergency response solutions that are currently available to customers to immediately implement. We as ResultsPositive also have training and implementation roadmap sessions where you can go through and kind of create your own roadmap and your draft of that roadmap within 4-hour session. So really look forward to engaging with you in terms of what's next to really help you achieve your outcomes. The next and last thing we wanted to highlight is that this is the first in series of webinars around healthcare outcomes. So we'd love to get your poll you and get your feedback on what would be the topic area you'd like us to focus on next. So today we focused a lot on patient care, but there's other topic areas. So quality of service, cost of service, health and wellness. So if you could just take a second and chat, what would be your top healthcare outcome you'd like to include in our next webinar. Also, we have various service delivery. So maybe it's around privacy and risk management. Maybe it's around that patient-provider service management that Jesse was talking about. Maybe it's that end-to-end operational resiliency that Jesse was talking about. So we definitely would like to make sure we have these webinar series aligned to areas that you'd like to focus in on. So I'm going to pause there and see if we have any other parting comments with Drew. We'll start with you first.
No, I think I'm good. Thanks everyone for joining, for sure.
Jesse and
so Ed, yeah, I was going to say Ed posted a question. He said, typically, how long does it take to transform and implement the entire transformation? So it depends. It's usually not a waterfall methodology that you would take. Continual improvement with an agile mindset is what we would advise. It's kind of the statement of how do you eat an elephant or how do you boil the ocean, right? One bite at a time or one cup at a time. So and this is where looking at what is the reward for the level of effort in the demand state will help you figure out which projects to tackle first.
Yeah, thank you, Jesse. Jeremy, any parting thoughts here before we close today's session?
No, appreciate everyone's joining, and I think John will share the recording out with others. And if you leave this and you have other additional questions for us, we are highly available to help you out. And thank you so much, John and team, for hosting. What a pleasure.
Thanks, everyone.
Have a good one. Stay safe and healthy.
Thank you. Thanks, everyone. Thanks for attending today. We look forward to having you join one of our next sessions. Thanks.